Hi, my name is Austin Wolf, and I will be talking about euthanasia. When you are terminally ill and have no chance of recovery, should choosing the time of your death be an option? By giving individuals this option, many could take an advantage of the practice to destroy any pain or suffering they are feeling. It will be the easy way out of a difficult problem. By administering euthanasia or physician-assisted suicide, we are teaching the world that it is acceptable to kill. Euthanasia should be illegal throughout the world because it goes against the moral beliefs that you shall not kill. So what is euthanasia? As stated on the dictionary website, euthanasia is the act or practice of ending the life of an individual suffering from a terminal illness or incurable condition. Euthanasia is performed by lethal injection or refusal of extraordinary medical treatment. Euthanasia takes on two possible forms, active and passive. Active euthanasia is the actions taken to end a life. This can be done by an overdose of painkillers or sleeping pills through injection. Passive euthanasia is when life-saving procedures are withheld. Doctors can acceptably do this, but it is a very emotional process. According to the WiseGeek website, there are three types of euthanasia: voluntary, non-voluntary, and involuntary. Voluntary euthanasia is done through the patient's request to end their life, and most governments allow this procedure to be done. Non-voluntary euthanasia is done when the patient cannot give consent due to unconsciousness, comatose, or is legally incompetent. Child euthanasia is illegal under any circumstance. Involuntary euthanasia is performed against the patient's will, and this would be considered murder. Euthanasia has been a big topic of uncertainty for quite some time. Many are still unsure of what the proper solution should be. During the Middle Ages, Christians and Jews were very much against euthanasia, as said by the Euthanasia Pro-Con website. They are believed that suicide and physician-assisted suicide was taking over the responsibilities of a higher power. They also believe that the life is a right and euthanasia takes away that person's right to live. In the 1870s, a man named Samuel Williams began using morphine and other fatal substances to practice euthanasia. This practice received serious attention because it was wrong to end the life of an individual. Physicians considered the practice but quickly determined that pain medication could be used to lessen the pain, not induce death. In 1917, a movie called The Black Stork talked about the controversy over euthanasia. In the movie, a baby was born with disabilities due to a disease. The Chicago physician convinced the parents that letting the child die was the proper thing to do, when in fact, surgery would have saved the newborn's life. Actions like this are unacceptable because that child has a very high chance of survival if surgery would have been performed. To this day, euthanasia is being strongly considered. Only 3 states allow euthanasia: Oregon, Washington, and Montana. Many fear that euthanasia will be used for the wrong reasons if it is finally legalized throughout the nation. There was a man named Dr. Kevorkian, also known as Dr. Death. He was a Michigan physician who helped his patients kill themselves, according to the Los Angeles Times website. Dr. Kevorkian assisted in suicides of over 130 people from 1990 to 1998. He believed he was trying to teach all the medical professionals to their duties, and that these duties include assisting patients with their death. Dr. Kevorkian's method of euthanasia was a little different than today's method. Dr. Kevorkian has a homemade machine that he connected to his patients. The needle from the machine first injected a harmless saline solution into the patient's veins. Next, a button was pressed that injected anesthetic thiopental sodium, which put his patients to sleep. Following the euthanasia was the potassium chloride that stopped the patient's heart. Dr. Kevorkian's actions were very illegal, but he had convinced and persuaded his patients and their families that euthanasia was an unacceptable procedure to perform. Dr. Jack Kevorkian served 8 years in prison for second-degree murder. Euthanasia can be practiced incorrectly because it is cheaper to put someone to death than keep someone in long-term treatment and care. It gives people the option of ending their lives instead of searching and finding a treatment to kill their illness. Medical procedures can also be denied because it is cheaper to end a person's life with an overdose of common pain medications. All physicians take the Hippocratic Oath. Euthanasia goes against a section in the Hippocratic Oath which states, "I will neither give a deadly drug to anybody if asked for it, nor I will make suggestions to this effect." Euthanasia has been looked at with great concern for many years. By legalizing euthanasia, physicians are taking away the patient's right to life, and some patients may use this to get out of a disease or condition effortlessly. Our government has passed this law nationwide for a reason, and it needs to stay this way. By legalizing euthanasia, physicians would take the advantage of the life of their patients. It would help them to find the quick way out instead of searching endlessly for a cure to their illness. Every individual should have the right to life, and by legalizing euthanasia, this would be taken away. Thank you.